Hi, it's Dr. Osafi with New Life Dental Implant Center. Thank you so much for choosing us as your dental implant provider for this life-changing treatment. We're very excited that you've elected to move forward. We're going to be sharing a lot of new information with you. It's going to be a lot, so buckle up for the ride. For this first part, we're going to be covering information before you begin your surgery. There are going to be a certain set of medications that you're going to be taking. One of them is going to be steroids. You're going to be taking 6 pills the day before your surgery starts. The other one is an antibiotic. If you're allergic to amoxicillin or penicillin, you'll be given a Z-Pack. You want to take 2 pills of that before your surgery day. Then you continue taking 1 every day, including the day of your surgery. With the steroid, you continue taking them after the day of surgery, including 5 the day of surgery, 4 the day after, and until the medication is completely gone. You also get a mouthwash that you want to use the day after surgery is completed. You swish with the mouthwash for 2 minutes twice a day, and that should be sufficient. Other than that, you have a pain medication, which is a regular over-the-counter ibuprofen, 600 milligrams. You can combine that with Tylenol for pain and take every 4 to 6 hours as needed for pain. Continue for the first 2 weeks, expecting that the pain will resolve as time proceeds. On the day of your surgery, we want to make sure that you arrive early, at least 30 minutes before your surgery visit. The procedure is going to be completed with IV or Twilight sedation. We want to make sure that you're able to maintain your own airway and breathe on your own while we complete the procedure and you have complete comfort. The reason we do this procedure with Twilight sedation is because we want to make sure that we're not taking a big chance on our patients. As soon as we stop administering medication, we want to be able to wake our patients up. Also, because we're very quick at completing the procedure, we only need about 2 hours of actual sedation, and Twilight sedation gives us the exact amount of time that we need. For some patients where we need a lengthier amount of time, general anesthesia may be used. You will be expected to have swelling that will last between 7 to 14 days. You may get bruising that can extend all the way down to the bottom of your chest, usually around the neck and the face area. That will typically last 7 to 10 days. In some rare cases, it could take up to 3 weeks to go away. Typically, patients resolve bruising pretty quickly. Other than that, bleeding is expected to resolve within the first 24 hours. We are also expecting to have some numbness the first 24 hours, but after that, all numbness should be completely gone. If you're experiencing any numbness or tingling around the face or the jaw after the first 24 hours, please let our office know right away. The day after surgery, you will be receiving a new set of teeth, which is going to be your temporary set. This is the set of teeth that you will be healing with for the next 3 months. We don't intend on removing this temporary set, even if there are changes that we know we intend to make to them. The reason we don't want to remove them is because the temporary set of teeth have been placed with the same torque values that the implants were placed, and removing the temporary will also potentially risk loosening the implants during the first 3 months of healing. With the temporary, we anticipate certain changes to take place. The bite is going to take some time to get adjusted to it. So you will notice some changes with the bite, the way the teeth come together. Changes with speech are expected, as well as changes with function. In addition to that, there are a lot of changes that patients need to get adjusted to. And this adjustment period can vary from 1.5 months to 3 months. With all the swelling that takes place in the mouth, a lot of the changes won't be visible until 2 to 3 months after surgery. It's very important for patients to know that the moment that the surgery is completed, with all the infection that's being removed, with all the extraction of the teeth and the placement of the implants, the procedure is extremely delicate and that the healing is our priority. Our intention is to make sure that the entire apparatus that we have created is healing properly. Because the implants were placed in a very fragile and just recently cleaned area, we want nothing to be altered with the bone, and we want the perfect conditions for the bone graft to heal properly. That's why we have our patients be on a complete soft diet. If the temporary moves or fractures, there is a system created within the temporary to fracture. If you notice that your temporary is becoming loose more often, it's because you're grinding or you potentially are applying too much pressure to your temporary. You may need to come in to the office for a tightening visit. In many cases, because of fear that the implants could fail, your dentist may recommend that you don't wear a temporary at all. If we see that your temporary is fracturing continuously, we may recommend removal of the temporary and placement of healing caps on top of the implants until healing is complete before we deliver the final restoration. Please understand that removing and making changes to your temporary right after the surgery is performed is not possible. It would merely put extra pressure on the implants and could potentially fail the entire treatment. So once the temporary teeth are placed, they can't be moved until healing is complete. Once healing is completed, your dentist will determine the changes that are necessary to be made to your final restoration. We encourage our patients to helping us decide on the shape and the color of the teeth while allowing the dentist to determine the function, the aesthetics, and the final outcome of the restoration. Once your dentist has determined that your restoration is ready for final fabrication, any changes after that will incur additional fees. In some cases, your dentist may elect to have another prototype or two made before fabricating your final restoration. This is to try in another set of teeth to determine the perfect bite and function before we fabricate your final set in zirconia. But once your doctor has deemed that the final prototype is going to be fabricated as your final, we don't want to make any additional changes to that prototype. It's very important that we move forward with the final restoration that the dentist has elected to choose to make sure that the final parameters meet the prosthetic functional limits that are necessary for your restoration to last a long time. At today's visit, we're going to be taking some records. You're going to be going over some consent forms. With the information that I've presented with you today, some further information will be given to you. Please make sure to read over all the instructions and ask as many questions as possible. Every treatment is performed by a highly qualified surgical team and prosthetic team and the laboratory team, all working in tandem to make sure that the process is completed with perfect results. Thank you.